It's just so strange how you can go from being totally fit and healthy one day to then having been told you have this condition.
Hello, I'm Mr. Irfan Sheikh. I work as a surgeon in Sunderland Royal Hospital. I'm working here since 2018. Well, cancer is a very big diagnosis for any individual. When someone is told about that they have cancer, it not just affects them, it affects their family as well. It's a completely life-altering or life-changing diagnosis when we give that to any person. Now, in the UK, the top 4 cancers which are diagnosed are number 1, breast cancer, then lung cancer, prostate cancer, and bowel cancer. The most common cancer which is seen in Sunderland region is lung cancer. Now, lung cancer can happen because of many carcinogens like having cigarettes, if someone is working in conditions which can lead to respiratory issues.
So my name's Karen Noble from Pallion Action Group in Sunderland. So I've always tried to speak as a community worker just from the heart and from my own experience. And I've had experience with going through cancer with my daughter through COVID. So I tell them how really important it is to get yourself checked. If you have anything that's just a little bit different, to make sure that you get it checked out. I've got 2 children and my oldest daughter was born with a genetic condition, so she's always had issues over the years of her life. She's just gone 34.
Hello, my name is Tony Ann Wood. I'm from Sunderland Paper First and I'm an advocate. We've did research for cancer. We do cancer training for people, like train NHS and around the world to make sure they get the point. We do.
She's got learning difficulties and she's on the autism spectrum. She's had lots and lots of different physical and mental and emotional problems. And then just before we got into lockdown, she had a little spot on her vagina. Took her to the doctors and they took a swab. It's fine, give her some antibiotics. And then she started complaining about an ache, just an ache in her leg. We'd phoned the doctors, they would offered physio. They said they would refer us, but it wasn't a priority. She was going on and on and on about an ache in her leg.
They thought it was muscle strain. They thought that they'd give us like tablets for her needed physio, but I thought no, there's something still not right about it.
And we took her to the walk-in centre, and when she was down, because Tony's very, she's got no inhibitions, so when we're in the walk-in centre, she was saying about the ache in her leg, and then she just said like, and I have this spot on my vagina. And they took a look and said, we'll refer you. So she went in the following week, we met the gynaecologist, and he was like, it's absolutely fine. It looks great. We'll bring her in for surgery. We'll take a look at it under a microscope, but she's going to be fine. She went in. She had a little bleed that needed attention, and then we got a phone call asking us to go in. So we went in, and he just had his head down, and he went, "I'm so sorry." And I was like, "Well, what is it?" And he was like, "It's cancer, and it's rare, and it's vulva cancer." I've got to say, the treatment she got, we got that in the July. She got into hospital for an operation. She had a lot of things taken away down below, and she got the operation in September, and she was clear of cancer by the December. So we've literally went in the space of like 7 months to being diagnosed and being clear. And I think that's the message I want to get across to people. This was just an ache in her leg, and she couldn't describe it, and she just didn't think it was right. And the first thing she said to us when she got diagnosed, and I told her she had cancer, I was like, right, need to tell you, Tony, you know, it's cancer. And she just went, I told you I was poorly.
I was in pain, I couldn't walk or nothing, and I was really, really, really upset about it.
There is a good amount of support system in the NHS where a lot of organizations, they give counseling to the patient as well as to their family.
I got offered counselling because Tony didn't understand what the actual implications were. All the terminology that comes with it and all the understanding and the benefits. And
when they found out that there was cancer, my mum was shocked and everything, and my whole family's been supported.
But I will say that the Macmillan nurses and the consultants at the QA at Sunderland Hospital were outstanding. So I had a very, very lucky experience, but I only think we were that lucky because of early detection.
Call of Duty and GTA.
I've got my husband is treating for cancer. He found marks on his skin, and he had to go and remove them, and it was tested cancer, and on his face and back, and he wouldn't go. Eventually he did go with a lot of nagging off grandchildren and wherever.
If you've got any concerns, to go and seek medical advice, go and speak to a professional, go and see your GP in the first instance, and then they'll signpost you or offer you other alternatives, whatever. But you must go to your GP because that's what their role is, to support you with any medical concerns.
These patients, they can be treated properly if they are screened earlier, and this can increase their life expectancy. A lot of individuals might think that because of COVID pressure, going to your GP with small symptoms can cause more burden over the health system. But if you feel that you have significant symptoms like chronic cough, weight loss, or other associated symptoms which might suggest cancerous condition, then it's quite important that you reach your GP so that the cancer is caught in the early stages. It's quite easier and quicker to treat, and that will reduce the burden over the NHS.
The frightening one for everybody was when it was on his face, because it was quite deep and not a nice sight to see, and I think it really frightened everybody. Through the sun, and he was a bus driver, and I think his arms are out in the sun and that.
And I think the importance is catching it in the early stages. That gives them, such power to help you and get a good result.
The main worst thing is the frightening that if we'd have ignored it and he wouldn't go, would it have turned into, especially on his face, to his brain, and then that would have been it. I think he just advised that everybody, anything like that, you get it checked over, how important it is, or you could end up losing somebody, which if you had the treatment, it would save you, hopefully.
As a community organisation, experience of cancer is something that is seldomly not talked openly, but I know that we have had people within the community die of cancer, and unfortunately for them to get the right support or even the screening and interventions has been done at a later stages where it's been too late. If cancer is detected earlier and interventions are done earlier, then chances of survival are much more higher.
And I think what I want to say, the BME community, the cancer is something very, like they're frightened. It's taboo, and it's also always kept in the family. It's really important that people should talk about it. It's really important to go to your GP and have that conversation, get the right information and the support it required. Going to the GP and early intervention will make a difference, and you will be treated, and it's not something that, yes, I have cancer and that's it, end of life. It's not like that. So it's important to access health service.
Although breast cancer is the most common cancer in the UK, it's quite easy to self-assess yourself for any nodules around your breast region, and hence you can catch these kind of cancer quite early.
It was a lady who'd lost her sister to breast cancer, and she decided to do something really positive about it. Set up a charity and with the slogan "Cop a Feel," and obviously it's quite out there. It's quite a funny way of getting it out there, and literally it's cop a feel, and to regularly check your breasts for lumps and how to check them. So, every month to check your breasts, all around, check your nipples, make sure there's no changes.
I do have a friend, she went through breast cancer. unfortunately, it wasn't a good outcome, and it was an awful journey. It was an awful period of time.
I'm Ruth Walker. I'm the manager of Southwick Neighbourhood Youth Project, and we are the community hub for the north of Sunderland. And we've got some wonderful green spaces in Southwick, and we've got our local green in Thompson Park, the riverside of course. So it's trying to spread a message about the things you can do. There are quite a lot, as well as the typical ones, which are stopping smoking, reducing your alcohol intake, eating less red meat. It is about being active and healthy. We run sessions with young people around cancer awareness, how to check yourself for lumps. We've got a set of boobs and testicles, and we can show young people where to check for lumps, what lumps feel like actually, what kind of lumps you should be worried about and what things might happen with your breasts. Active Families North East are going to be running an active toddler and parent session as well, which is great because that, it really brings families together, and that'll be about exercising together and hopefully something that is passed down generationally. I think some people may have been worried over the pandemic about, stretching our NHS, but I think, nowadays that you quite reasonably can expect to recover from breast cancer, so people shouldn't put off getting things checked out. If it's caught early, then it's easily treated.
Some cancers have genetic predisposition, and hence if you have a family member who has been diagnosed with a cancer, you should be screening yourself more regularly. For example, the well-renowned actress Angelina Jolie, who had BRCA gene in her family, got herself checked and got treated herself before she developed a cancer.
Just over 2 years ago, I was diagnosed with stage 4 adrenal cancer, which is an extremely rare cancer. I am literally 1 in a million. I had no signs at all. I was laying in bed on the morning, enjoying me lying, and I got a stomach cramp. Felt like I was going to be sick. I lay and I put my hand on my stomach, only to feel a large lump. Instantly knew something wasn't right. So contacted my doctor. They said, right, okay, we'll book you in to see a nurse. We're going to send you for a scan. All your internal organs are fine, including your spleen. However, you do have a large solid mass. The only way to deal with it was by surgery to remove it. Let's say by then it had already moved from my adrenal gland to my right lung. So I also had a 5 centimetre tumour in my right lung as well. The condition I've got is not curable. It can be held back with certain medication. However, the medication that I'm on at the moment isn't working. For me, it's slowing it down, but it's not putting a stop to it. I only found out 2 days ago that I'll start IV chemo next month. Sorry, I guess. Upset. It's just so strange how you can go from being totally fit and healthy one day to then having been told you have this condition. It is so important that any signs at all, you go and get checked. You must go and get checked. If I hadn't lost that weight, I never would have found the lump. If I had taken more care of my body and hadn't put that much weight on, I would have found it at an earlier stage, which then would have meant it would have been curable. It was the amount of fat I was carrying that had hidden it. Take a look at yourself. I've got 3 children. The main focus now of my life is them. I know possibly my time scale, so I need to make what time I've got now precious to them, make memories. Don't get us wrong, I'm not giving up. I've been given a prognosis, 30% chance of living 5 years. That was 2 years ago. I'm not accepting that. I will fight every day to get through and beat this. I might not beat it in the long run, but I will beat the 5 year.
Nowadays, all the cigarette packets, they have this logo on that, and it's written on it that 9 out of 10 cancers of lung happens because of smoking, and it also labels that smoking can kill. But still, we can see a lot of teenagers or young adults are copying their parents or their peers under pressure so that they could be part of the group.
Smoking has always been an issue in our area. To find lung cancer being number 1 in Sunderland, or at least the Sunderland area, is not a shock. I do think adults do have a responsibility, especially for the younger people. Therefore, they should be leading by example. And when adults maybe realise and recognise how many youngsters maybe are taking up the habit of smoking, actually they're just following the example that's been led before them.
I think if you say like your parents smoking, your grandparents smoking, it's sort of like monkey say, monkey do. So they think it's okay. It's really important that young people can learn more about like the health and the dangers of smoking as well.
I mean, it stands to reason, doesn't it? If a child or a youngster, even from being a toddler, growing up through adolescence, sees an adult or a parent especially doing something, why shouldn't they think, if they do it, why shouldn't I do it?
My husband's best friend's just been diagnosed with prostate cancer, not a symptom, nothing, just a small little lump on his neck where his sister just went on and on for him to get checked out, and he's absolutely in shock. I think it's really important that people need to go and get checked out. Cancer hasn't gone away just because COVID's came, so we need to get that message back out to people.
So the message is clear. Cancer doesn't always have to mean life ending. If we catch it early, we can treat it.